Hi there, I'm Mabel Jong. You're watching the World Healthcare Congress Interview Zone, and I'm so pleased to have Dr. Richard Salmon here today. He's with Cigna Healthcare, and Dr. Salmon, it's so great to see you again.
Thank you very much.
And you're focused on the area of performance measurement and improvement.
Yes.
What do you think consumers will be looking for as we look to improve the delivery of care and making it more affordable?
The consumers have had a trend in the last decade of having more choice of where they get care. Networks have gotten larger, and consumers have therefore had more choice of physicians and hospitals that they can go to. Where we haven't done the kind of job that we need to do is to provide better and better information about cost, quality, and patient experience so that they can make a more informed choice about actually where they get care.
Okay, and where will that come from?
The health plans working in concert with healthcare professionals to constantly improve our methodology for evaluating cost, quality, and patient experience, and then health plans working to share that information with consumers through our websites, through mobile applications, and through other tools that will make that information available to the consumer when and where they want it.
Has that been a very involved endeavor?
Yes, it has, in two ways. One is the science of measuring cost, quality, and satisfaction, I think, is only at its beginning stages. We will be much better at doing that 20 years from now than we are today.
Why is it so difficult?
Because the core aspects of healthcare quality, cost, and the individual patient experience are actually quite complicated and quite unique to each consumer. And we've also really focused in this area only in the last 5 to 10 years. So we have a lot to learn as we move forward.
How do you think, how will incentives be aligned with healthcare professionals to reward achieving the triple aim? And I'm stumbling over that because it's something that healthcare professionals are really aware of, but consumers are just starting to get to know this.
Sure. The triple aim stands for better quality, better satisfaction, and better cost of care. So all three dimensions that consumers are interested in. There are two ways to align incentives. One is to transition the fee-for-service system from reward for volume to reward for value. So value-based rewards back to healthcare professionals around those outcomes is what we need, and we need mechanisms that do that not only for the largest systems that are capable of being accountable care organizations taking on full responsibility for population health, but also for the 2-physician family practice or the 4-physician cardiology practice. So we're moving forward, others are moving forward in that mechanism. The other thing that is critical here relates to my first comments, and that is providing consumers with the information about where the highest quality, most affordable care is, helps to direct volume of care to those most highly performing segments of the delivery system. That is a reward that is tremendously important to healthcare professionals. Of course, they'd like to be paid more for delivering good quality care, but they also want more patients. And so that's where these two things come together in a tremendous synergy that I hope that we'll see over the next 10 years.
We have several deadlines looming in the future. Is a lot of this information going to be ready for, say, the exchange when the exchanges come online in October?
Yep, I think the answer is that the basic information will be ready. Most health plans, Cigna Healthcare included, provides this information today. As I mentioned, we have a long way to go in terms of improving it, but the fundamentals are there to find out things ranging from what is the cost of an MRI at a local hospital or a local freestanding imaging center, all the way to what are the quality outcomes around total knee replacement at a hospital. That kind of information is there today and will be available on a plan-by-plan basis for those plans who participate in the exchanges. So
a lot of work still needs to be done, but what are you most encouraged by so far?
You know, I'm most encouraged by two things. One is the technology that is coming forward to make the information available to consumers when they want it. So a mobile app that tells a Cigna customer when he's leaving his doctor's office with a prescription for an MRI, okay, I can find out what the cost will be out of my pocket, what won't be covered by the health plan for my various MRI choices right now when I need to know it. That's very encouraging. The other encouraging thing is healthcare professionals. I work a lot with hospitals, physicians group, all segments of the healthcare delivery system, and more of our healthcare professional partners are getting aligned around actually achieving better quality, more affordable healthcare. So it's really an exciting time to be in the healthcare system.
That's very encouraging news. Thank you so much.
Thank you very much.
Pleasure to meet you, Dr.
Nice to meet you too.
And I'm Mabel Jong. Thanks so much for watching.